Welcome to Treasure Coast Community Health, with 7 locations to serve you better. We have a dedicated staff. And now, here's your host, CEO Vicki Soule.
And welcome to Community Conversations. We're happy to be here again this week as we march, or rather spring forward into May. We've just got a little bit of time left in April. But this is a time to spring forward and think about new beginnings. And certainly all of us are hoping that our new beginning will include less COVID and more family and friends. So if you haven't gotten your vaccine yet, I strongly encourage you to do that. I know there are folks that are still hesitant about putting that foreign substance into our body. But I can tell you that we've done that for a very long time and thanked science for doing that. Everything from vaccines to, as we're going to talk today, about treatments for cancer and other diseases. It would be wonderful if our bodies could fight everything off by itself, but there is better living through chemistry, whether you point to a rarity or not. I, again, would encourage you to think about it very seriously to protect yourself, your family. It might not keep all the bad wolves away, but it keeps those monstrous ones, and that's for sure. So today I'm here with Theresa Woodson. Theresa and I go way back to the American Cancer Society, and Theresa is here to talk about one of my favorite topics, and that is prevention. Welcome, Theresa.
Thank you so much. It's always a pleasure to be here, and thank you for what you do in our community to always bring health issues to the forefront. We need that. We need those reminders. Life is busy.
And it's not a dress rehearsal.
No,
the older
it's
I
not.
get, the more I think about, gee, I wish I had, or what would have been different if we as a society had done this or that. And this is one of those kind of watershed moments, too. I've shared before, I lost an aunt to the Spanish flu. I never knew her, but she was my grandmother's first child, and she carried that pain with her all through her life and passed on the what ifs as she grew older. What if they had had something that would have helped her in an immunization? And so I bring that forward as something that, again, is not real comfortable for most people to hear. Even my own family says, all right, already. But they need to hear it, in my estimation. So thank you.
Well, and how many things, honestly, I mean, vaccinations do we just count on because they've been around for so long, and we just know, we don't question at all. Mumps, rubella, is it rubella?
Yeah, rubella.
Measles, diphtheria, all of these that our children go through, polio.
We still give out polio vaccines so that we don't get it here.
It is a little bit of a hurdle to get to that point of confidence, and education is what helps us get there. So thank you for educating our community.
Well, nothing in life is perfect, but it's a whole lot better than the alternatives.
Mm-hmm. So. And that the vaccines are definitely a part of that need for education, but there are some other things that we all should be doing and be aware of and should resume in some cases when it comes to reducing our risk for cancer. And it may not be, there's not a cancer vaccine, but there are many cancer screenings available to us that allow us to detect cancer early. And history has shown us that the earlier we find it, the more likely we are to survive cancer. Right. And there is just, breast cancer is probably the easiest place to show those numbers. Breast cancer screening, early detection, a stage 1 breast cancer, it's a 90 to 100% survival rate. Our website stays on the conservative side with 90%, but we have seen, health organizations documenting higher levels than that. So, and I have seen all the way up to 100%.
For those women that are sitting at home saying, well, I'll wait till the rush is over. The rush is over.
So when you look at that weight, and all of this information is on our website, but with breast cancer, I think it's just a great example. The stage 4, the developed cancer, the survival rate is 26%.
Those aren't really good odds. I wouldn't bet on a lottery ticket that way.
There
you go.
You have a choice, and actually, I say you have a choice, but we know that in some communities, that choice isn't so easy, and that's something the American Cancer Society is addressing as well.
Well, I think of barriers, and what's the main barrier for a woman to get a mammogram? I'd say besides fear and procrastination, the real barrier would be cost. And so I have to plug in here that Treasure Coast Community Health does have a program. We've been generously funded again this year by the Johns Island Community Group. Their service league has donated funds to Treasure Coast to help women with both mammograms and their pap smears. And many organizations in the past, including state-run and locals, have offered low cost or free mammograms. But if anything comes up on that screening mammogram, it's sort of like, oh, sorry, that's all our funding is for.
Right.
We're not doing that. If there is the need for a diagnostic mammogram, to go on to a 3D, to go on for an ultrasound or a stereotactic biopsy, whatever it takes to get that diagnosis so that you can get the treatment, the appropriate treatment to knock it out, that's what we do. So please don't hesitate to make an appointment at Treasure Coast Community Health for a well women's visit, and we certainly will have you meet with a health navigator if you are without insurance or if you have high deductibles. So we try to eliminate that. Unfortunately, we can't completely eliminate the fear factor of, well, what if it's positive? But I can tell you with great assurance that we have many people, many women every year that do end up with a positive diagnosis for breast cancer. And they either receive the surgery and or the chemo, and we're with you every step of that way.
So if it's okay, I want to just, sure. we jumped right into this.
We did.
Because,
sorry.
Well, no, I mean, because the conversation is just one that rolls that way. We talk about vaccines, we talk about screening, but why are we talking about this? And I think, we've talked about these things for years, you and I.
We have.
But this year the conversation is really heightened. Mm-hmm. And I want to give some info. I'm going to put my glasses on so I can see, because these are numbers that are not the usual. I could throw those other numbers out because they've been ingrained in my head over the last 10 years.
Year, right.
But this is a post-COVID conversation. Okay. Because COVID is not, the impact of COVID is not limited to the disease itself.
Absolutely.
The impact of COVID has become very significant on the cancer front, because as a result of COVID, we know that an estimated 22 million cancer screenings were canceled or missed between March and June of 2020 nationally. So when you look at that,
22 million have been postponed just in that short period of time. Mm-hmm. And I dare say if they were to roll the numbers forward, they would not see a huge lessening of those numbers, unfortunately, until the vaccines started to be delivered.
Well, and unfortunately, we have also, seen that more than 600,000 people died from cancer in the United States in 2020. Now, I can't say that all of those were, because they didn't get their screening right, a delayed diagnosis. But what I'm saying is, cancer deaths is a real thing, just like COVID deaths is a real thing. Yeah. So 600,000 people died from cancer in the United States in 2020. The earlier cancer is detected, the better the survival rate. And because we're seeing that more than, there was a study that just looked at cervical, colon, and breast screenings. And just for those screening tests dropped by more than 80% in the spring of 2020. So the National Cancer Institute states that almost 10,000 additional deaths are expected just in the areas of breast and colon cancer. So over the next 10 years, because of pandemic-related delays in diagnosis.
Because the earlier you're diagnosed, the shorter the treatment or cure for that.
For sure.
So you bring up the second phase, colon cancer. We have, unfortunately, not gotten as easy a solution as we do for breast cancer screening, in that the fear factor and the cost factor are both increasingly more difficult. I know that when they first suggested I have a colonoscopy because of family history, I said, isn't there something shorter, easier besides going under?
And there is.
And there is.
And there is.
So let's talk about what has been developed and what is recommended these days.
So the American Cancer Society actually has a really nice section on their website. Our website is cancer.org. It's very easy to remember. And there's a little magnifying glass up there on the top right. And if you click on that, you can get a search window and you can search for almost anything. But if you look for colorectal cancer screening, you will find information on the various types of screening for colon cancer. So, and it's a decision. And I actually have a printed copy. We call it the decision guide.
And we'll post that onto our website.
That would be wonderful. It's a really nice piece. It's very simple to follow. The age recommendation for someone who is not at risk, someone who does not have a history of colon cancer in their family, would be age 45 or older. And that was recently dropped.
It was. It used to be 50. But
we were starting to see colon cancer incidence in younger and younger ages. And so that is part of the reason for the change in that protocol. And that change in protocol is widely recognized by your physicians, by your insurance companies. And yes, I do realize that not everyone has insurance, but we have Treasure Coast Community Health.
We do.
So,
we'll help you out there.
So good for us, right?
That's right.
But there are a number of tests. Some of them you do in the privacy of your own home. It's just they're stool tests, and so there's a few. The fecal immunochemical test. It can be done once a year. It's basically you just take a little sample and you put it on a card and you send it back to your lab.
And they'll say, we got a fit test.
Right. There's another one that's called it's FOBT, or a high sensitivity. Can't pronounce this word. I am not a doctor.
That's okay.
So I don't know, Guaiac based.
You're right. That's the old fashioned
fecal
one.
Occult blood test, which is another stool sample test. And then there's a DNA test. And I think we've all seen several commercials for that one, the little square guy that dances around the room and jumps up on the toilet. But again, there's three right there you do just right in your own home.
And Treasure Coast gives out the fit tests left and right. The problem is we need to get them back, okay? Mm-hmm. Rather than argue with us, people take them probably with very good intentions. And they just never think about it at the right time. The moment passes and it's in the other room or something. So, and I've had to have tests like this done for other reasons, and actually quite recently. And it is a little weird, It is. What do you do with that little container? That you can't. It has to be frozen if you don't bring it right to the lab. The test that I had done anyway. Yep. And so I just have a little brown lunch bag, and I say right on it, "You don't want to open this." And I put it in the freezer until I could take it to the lab. But then, of course, there's the colonoscopy, and for someone who is not of high risk, those are recommended, like we said, at age 45, and then every 10 years after, if there's nothing found. But sometimes that will change to being more frequently based on what is found, and if a polyp is found, it could be completely, and most times is completely benign. Yep. No
but
worries.
Left there. It has the opportunity to become a cancer. And so the colon cancer screening is, to me, it's not just a screening. This is truly where we get to prevent cancer. I mean, that is just phenomenal.
It certainly is.
And And I have a volunteer who used to work for the American Cancer Society. Some of your viewers, listeners will remember the name Nancy Madsen.
Oh, yes.
And recently I asked all of our volunteers, why do you do this?
Huh?
And her passion is to help people and educate people about preventable cancers. And colon cancer is a preventable cancer.
Sure is. And, I say that because I have family who have had late stage colon cancers detected. And so when they said, you need to have it because of family history, I did say, is there something else? But it works. It does work.
It does.
Let's take a short break and we'll come back and we'll talk about a couple of other things. And before you know it, we're going to be
we'll be running out of time again.
Hi, I'm Vicki Soule, CEO of Treasure Coast Community Health. Treasure Coast Community Health has been serving Indian River County for 25 years. How did we get here? It took a commitment to you to provide you with the most affordable, high-quality, integrated network of healthcare available anywhere. It took board-certified doctors and dentists and a dedicated staff to ensure that you receive the best possible care. It took more locations to meet the need, and now TCCH has 7 locations, with the latest one conveniently located down the street from Cleveland Clinic Indian River Hospital. Our services are available to everyone, whether insured or not. And at TCCH, no one gets turned away due to an inability to pay. We rely on donations from generous benefactors to continue our much-needed work. We accept Medicare, Medicaid, and almost all insurances. Call us at 772-257-8224 or visit us at tcchinc.org.
Are you opening a used car lot, pawn shop, a restaurant that will serve beer and wine? In the state of Florida, these and many other industries require a Level 2 live scan background check for clearance to work in your industry. A1A Fingerprints is your certified live scan source from Broward to Brevard. And if you're a medical provider, you need to be registered on the ACA web portal. A1A Fingerprints will help you navigate and comply with the law. Call 772-494-6556 or visit a1afingerprints.com. A1A Fingerprints.
Hello, this is Carol Jean Jordan, your tax collector here in Indian River County. All of our offices are scheduling appointments for in-office services, but you can get that little yellow sticker quicker by using our express lane. It's fast, convenient, and free when you pay with an e-check. Renew your registration on our website and select Pick Up at the Tax Collector's Office. Order before 3 p.m. and you can pick up your little yellow sticker on the same day. Order at irctax.com. That's irctax.com.
And welcome back to Community Conversations. This week I have an old friend with me. Theresa Woodson has been the leader for our 3 counties, 2 that surround Indian River County, and going up into Brevard. We were just talking about the Mary Brogan program, the Breast and Cervical Cancer Reduction Program, that's been in effect for probably 15 years?
Yeah.
10?
I think it's about 10 because I believe it was my first year.
Okay.
And when I first started working with the American Cancer Society and learning about the Cancer Action Network, which is our sister organization that does the legislative legwork, if you will. They're in Tallahassee and in Washington, D.C., so state capitals across the country, and of course our nation's capital, watching to see what is done with your taxpayer dollars. These are dollars that were already taken. We are not asking you to donate those. And but we want to make sure that the cancer conversation and the needs of people when it comes to detecting cancer and treating cancer, that those are acknowledged and
still on the radar.
Yes. And so Mary Brogan was the wife of Frank Brogan, who was our lieutenant governor at one time. And he's actually from the Treasure Coast. They both lived in Martin County. And she worked for the school district and then went on, I believe, to work for the Department of Education for the state. But she did pass away from breast cancer. And Frank Brogan lent all of his influence and his passion to trying to make sure that there was something in place. And on the federal level, there is money available, but you have to have a state program in order to tap into those federal dollars. So the state has to fund some, and then the federal government funds additionally. So it's called the Mary Brogan program. And every single year, we have not yet been able to get it built into the budget as an automatically renewable item. So every single year, we go to Tallahassee. Our volunteers, through Making Strides and Relay and our boards across the state and so forth, and they know this becomes part of the conversation every year. They join our Cancer Action Network, which is just ACSCAN, CAN.org. And they get notifications when this comes up for conversation. And that, and also some research money that is allocated by the state. And so these are important things that happen. And through this, and a few years ago, we actually had one of our doctors here in town, that TCCH was involved. The health department was involved. We put together a collaborative and did clinical breast exams for free on a Saturday. This is pre-COVID. And that was all set up with the Mary Brogan program, so that if we had any diagnoses come from those exams and mammograms, that there would be a continuum of care.
And this year particularly, with so many people losing their job and then losing their health insurance.
Yes.
That's got to have made an impact.
Some other really staggering numbers that are just, 14.6 million Americans lost their health insurance in the summer of 2020 due to COVID-related job loss. So the thing that we know even prior to COVID is that the uninsured typically, screening rates among the uninsured is typically 40 to 50% lower.
So
even with TCCH.
Even with us.
So this has now become, the I would say, for us, the screening conversation has always been there. Yep. We've always had a one sheet that we hand out with all the different screenings and when you should have them and who should have them. But COVID has heightened this conversation by far, and has created an environment where we are bringing several other organizations into the conversation. A large campaign will be launched in mid-May.
So we're on the cutting edge. We need people to say, Treasure Coast, can I come in and talk to you about preventative screenings? And we'd love to take care of you.
And we need anyone who's listening to have this conversation with their friends and their family and their coworkers.
It's time.
It has to happen. It has to happen.
Absolutely. Well, thank you so much, Theresa,
Thank you
for bringing all of this information. We tend to deal with what's in front of us and our personal health, unless there's something really actively going on, tends to get the short shrift of our attention. So thank you for bringing it back up to the forefront. It absolutely can be a lifesaver, just listening to this conversation and saying, I'm going to check in with one person, and maybe I have to model the behavior myself. Maybe I have to say, Susie, it's time you and I both make an appointment. Okay? So thank you for doing that, Theresa.
Thank you.
Appreciate it. And thank you for being with us today. We hope that every week we bring you information that is useful to you. It's certainly all over the place. Sometimes it's a nonprofit that helps us with healthcare issues. Sometimes it's something else entirely. You never know what to expect, so I hope that you'll tune in next week again. I know it's pretty early when we're on our broadcast, but again, we try to keep things lively and informative and are always, always hoping for your best health. Thank you and good night.